you guys look really cool. Okay, somebody's getting pictures of this. Okay, now, the first stance, and I'm going to turn around so that I don't get everybody confused. I'd like for you to bring your arms up above your head and clasp them together and stretch them all the way up like this. And come all the way down. Up. This time I want you to breathe in. Breathe in. Breathe out. Breathe in. Breathe out. Here comes the last one. You better make it good. Breathe in. Breathe out. Now this next one is called the bow and arrow. What I want you to do is take your left hand and put it up in front of you. And I want you to take your right hand and bring it down by your side like this, as if you're stretching a bow and arrow. And I want you to follow your left hand all the way to the left while you're bringing your right hand back. Like you're stretching a bow and arrow. And bring it back to the front. And this time we're going to take our right hand and do the exact opposite. We're going to follow our right hand over with our eyes and take our left hand down by our side and breathe in. And breathe out. This is a 4,000-year-old practice, folks. Breathe in. Breathe out. Every morning, breathe in. Breathe out. Last one over here, breathe in. What you're doing is you're really expanding that rib cage so that you can get the full breath. And the last one on the side, breathe in. And breathe out. This next one is called parting the clouds. You guys want to part the clouds? Okay, we're going to part the clouds. You're going to take your left hand and you're going to push it up towards the clouds, and your right hand is going to go down towards the ground. So you're going to breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Turn around and look. Breathe out. Last one. Breathe in. Breathe out. Breathe in. Breathe out. This next one, we're going to show the world our heart. Show the world your heart. So what you're going to do is you're going to bring your hands out to the sides. And again, this is where you guys are going to sit beside each other. Bring your hands to the sides. And then I just want you to twist to the left. This. Open heart, and back to the front, your arms in front. And now, you're going to come to the right and breathe in.
Look at your way.
And breathe out. Breathe in. Breathe out. Very good. Breathe in. And out. And the last one here, breathe in. Feel free to sit back down if you want. This is all about you. Breathe out. Last one over here. Breathe in. And breathe out. Awesome. Okay. You know, we carry a lot of tension in our necks. We carry a lot of tension in our necks, so it's very important for us to loosen up the neck a little bit. So this time what I want you to do is just let your neck fall, let your head fall to the left, and breathe in. And breathe out. Forward. Breathe in. And breathe out. To the right. Breathe in. 4,000 years old, folks. Breathe in. And breathe out. To the left. Breathe in. And breathe out. Forward. Breathe in. I'm going to turn around and just take a look at you guys. Breathe out. To the right. Breathe in. And breathe out. And back. Breathe in. And breathe out. I like what you did. I saw that. You can actually just kind of turn your head to the left. Breathe in. And breathe out. And forward. Breathe in. And breathe out. And now you can just look over to the right. Breathe in. And breathe out. And back. Breathe in. And back. Okay, we have 3 more to go, class. 3 more to go. All right, this next one You're just going to bend forward, and you're going to come back with a deep breath in, and then back to center. Right? So I want you to bend forward. Now this is important for you, and just do what you feel comfortable doing. I'd like you to bend forward, and I want you to breathe in, and breathe out, and come back to center. Forward, breathe in, and back to center. Forward, breathe in. Coming up, coming up, coming up, breathe in, and back to center. Very nice. Okay, I'd like you to place your hands and place them on your hips. And do the hokey pokey. I'm just kidding. All right, so I'd like you just to fall to the left. Breathe in. And breathe out. Forward, breathe in. I do this every morning when I get up. And breathe out. To the right, breathe in. It's very important you do what your body is telling you to do. Do what your body is telling you to do. And we're going to go back. Breathe in. Be careful with this one. Be careful. And back. Now the last one to the left. Breathe in. And breathe out. Forward. Breathe in. That's it. And breathe out. To the right. Breathe in. I like what this gentleman right here is doing. He's going as far as his body's telling him, even if it's just the slightest bit. And let's go back. Breathe in and breathe out. We have 2 more to go, folks. 2 more to go. Can you do it? Okay, this is everyone's favorite. It's called the angry eyes. So what you're supposed to do is think of something that makes you real angry. Something that really makes you mad. It's called the angry eyes. You're supposed to look mean like this, okay? And I want you to bring your fists in the air like this. And you're going to throw a punch with the left first and then the right. Except there's a little twist. I want to hear you breathing out. And the way it's going to sound is like this. Okay? Okay? Left first. Okay? So we're going to punch to the front first, and then we're going to punch to the left, and we're going to punch to the front. So here we go. Angry eyes. Angry eyes. Breathe in. And left first. There we go. Now we're going to punch to the left. The left first, right first. Breathe in. There you go. Breathe in. To the front. Now we're going to punch to the right. Breathe in. Left, right. Very good. Breathe in. And the last one to the left. Breathe in. Now, this is the last one, folks. And I love this one because I call this one gratitude. So I want you to think of anything that you're grateful for. Anything. Anything you're grateful for. I'm grateful for my toenails right now. I'm very grateful for being here with you folks today, sharing this group right here. I'm very grateful for that. What you're going to do is, with your feet shoulders width apart, you're just going to go up on your toes and come back down with a little bounce. Okay? You don't have to go way up on your toes, but you're just going to go up with enough control that you can come back down with a bounce. If you find yourself kind of going forward a little bit, then you widen your stance a little bit, or you lessen your stance, okay? So breathe in, and breathe out. Breathe in, and breathe out. Breathe in, breathe out. Folks, those are your 8 stretches. What I want you to do is I want you to take your hands up above your head, and I want you to bring them around your shoulders, and I want you to pat yourself on the back because you guys just did the Qigong stretch. Congratulations. All right. You may have a seat, except for I would like for my nurse here, what's your name? To come with me. Bobby, please come with me. Everybody have a seat, because the final question that I always get is, Dr. Morris, how do I remember these stretches? And so Bobby and I are going to demonstrate how you can remember the Qigong stretch. Okay? Now I'm going to tell you the Qigong story, everybody. The Qigong story. It's about Bobby. It's about Bobby. So, Bobby, I'd like you just to stay right here. And I want you just to do as I do, as I tell the Qigong story. Now, as I tell you the Qigong story, you have to think, if I mention a tree, I want you to think of a big flaming tree. If I mention a bow and arrow, I want you to think of this bow and arrow that's on fire. I want you to think, you have to really use your mind. This is that mental resiliency I was telling you about before. Okay? Once upon a time, there was a wonderful person. Her name was Bobby. And Bobby came here to learn as much as she could about lung issues and stuff like that. And so Bobby decided to climb a tree. And once she got to the top of the tree, she wanted to shoot a bow and arrow. Shoot a bow and arrow. Up into the clouds, to part the clouds. To part the clouds in order to show the world her true heart. Show the world your true heart. But you know something? There's always some crap, isn't it? You know, there's always something that gets in the way. Somebody that tells you that you can't do it, or there's some medical issue that comes or something. There's always a problem. There's always a bend in the road, right? Right, Bobby? There's always something, isn't it? Always something. Always some stuff, you know? Always a bend in the road, a bend in the road. And you know what that bend is? It's always fear. It's fear. We're scared of what's going to happen what happens if we do the Qigong stretch in the morning? I might hurt myself, or somebody might look at me and think I'm weird. I've been weird a long time, folks. Don't worry about it. It's actually pretty cool. All right, so it's fear. It's fear. It's fear. This is the head to the side. It's fear, okay? So you know what happened to Bobby? She got tired. She got tired of all this fear. She got tired of this. So you know what she did? She bent forward. And she came all the way back, all the way back, all the way back, all the way back. And she shouted to the world, and she shook the world, and she said, if you want things different, you have to do things differently. If you want things different, you have to do things differently. So now, Bobby's ready. Angry face, she's ready. And every single problem that came her way, Bobby was ready. She was ready because she was ready with a peace and a stillness to bring to these adverse circumstances. She was ready. And then ultimately, in the end, Bobby was humble and grateful. Humble and grateful. Humble. Everybody give Bobby a hand. Wow. That is the Qigong story, and that's how you can remember the 8 steps of Qigong. All right, folks? Listen, that's my time. I'm sorry to take up so much time, but I get into these things. I hope that you learned something today. I'm charging all of you, okay? But I'm charging you all now. You must take something you learned today and teach it to someone else. This is one of our principles in the Morri's Cardiovascular Risk Reduction Center. We have all of our patients. If I've taught you something, you teach it to someone else. Because this is how we can teach each other. And so that's your responsibility. Take 1 point today, one of those 9 points of longevity, the resiliency, and teach it to someone. Let's teach each other, teach each other, teach each other. All right? Any questions at all, folks? Thank you so much. I really enjoyed today. Thank you.
And if Dr. Morris will permit us, we'll have this on the website. And then we can get Eric to separate the last part so you can go straight to that section. If you've forgotten any of these. What do you think? Morris, I want to thank you for coming. We've got a small appreciation.
Wow, fantastic.
Thank you so much.
It's my honor. Thank you so much. All right.
Oh, hey.
I know. Thank you. Yay.